Okay, we're back here, and I want to, before we get into the really great content about back pain, it's important to kind of change the mindset. And when I meet people initially when they're struggling with back pain, whether it's been weeks, months, years, decades sometimes, there's this burning desire to get and want an MRI or an X-ray, an image, to be able to see what's going on inside of there. And I think that oftentimes is a barrier for people. They want that before they will allow me to help them. And so we need to address that issue right now. And I want to give you every piece of evidence that I have to help you realize that you don't need and you shouldn't want an MRI or an X-ray. And let me kind of dig into that a little bit. So the only reason you would want to get an MRI or an X-ray, and I use those two images as, I call them pre-surgical tools, meaning if surgery is imminent, you should have one before the surgeon goes inside there so they can have a sense of what they're looking for and where to go. So red flags would be, there's really four of them. If you suspect there's a fracture, if you suspect there's an infection, so a fracture would be after a fall or an accident, right? Typically, you're not going to fracture your spine by just walking around. It's going to be after some acute trauma. So if you had a car accident and you think that something hit you, then yes, you should have an image. Number two is an infection. And infections come with other symptoms, right? Redness, hotness, swelling, and of course a fever. So if we have those things, then again, if the doctor suspects an infection, by all means, an image of the spine makes sense. Think like meningitis or something of that nature. Number three is if you have changes to the bowel and bladder. So if you lose control of your bowel or bladder and your back hurts, then you should have an image. You can get nerve compression from back issues, many different ones, that can compress the nerves to such degree that you lose control of your bowel and bladder. And in that case, whatever's causing the compression needs to be removed immediately so that you don't lose control of your bowel and bladder forever. And then number four would be severe motor weakness. So we know that the nerves that travel down your arms and legs, in this case your legs because we're talking about the lower back, they get irritated by back pain, right? They travel, or pain travels on them, but so does the strength and the feeling to your legs. And so if the nerve is being compressed to such a high degree that you start to lose muscle control, so for example, foot drop, where you're walking and your foot is slapping on the ground because you've lost strength, those are also reasons to get an image. Other than that, though, science would indicate that imaging does not help the patient get better. And it also doesn't help the provider, me, the doctor, find you a solution. So in fact, there's research to show that getting images when you don't have those four red flags can actually make things worse. It can make the outcomes for you more expensive. It can make them take longer. And it can also make you have procedures that don't help you and that can actually make you worse. So let's look at some of the data to support that. This is not my opinion. So we know that MRIs increased from 7.2% in 1999 to 11.3% in 2010. So in just an 11-year period of time, it increased significantly. This is in the country. As a result of this increase in imaging, the percentage of patients who were directed to spine specialists, which are surgeons, for interventional procedures and surgery, so I think injections and surgery, more than doubled in that period of time, rising from 6.9% to 14% in the same period. However, the outcome of the surgeries performed and the injections or interventions are only 50% successful, and they haven't changed in that time period. So the procedures didn't get any better in their outcomes, but we gave more people the procedures. Why is that? Well, because that's linked to an increase in imaging. So the Mayo Clinic in 2014, researchers found yet again that disc degeneration was normal at all ages, regardless of whether somebody has pain or not. So you can give, and we're going to talk about this in more detail, but we're going to talk about this. It's normal to find disc degeneration in a spine when you give it an image. Yet disc degeneration becomes one of the leading indicators for a procedure, either an injection or a spine surgery. Yet you're going to find it in anybody at all ages. So really that's saying you shouldn't use that indicator to come to the conclusion that somebody needs surgery or a procedure such as an injection. We also know that disc degeneration was present in more than a third of asymptomatic 20-year-olds. So more than a third of pain-free 20-year-olds had disc degeneration on an image, and 96% of 80-year-olds in the study. So basically, as we get older, it increases, but even in the 20-year-olds, we're finding 1/3 have disc degeneration, but they have no pain. And the 96% of 80-year-olds who were imaged who had no pain also had it. So again, black discs, which is what is referred to as disc degeneration, they're measuring the space between the joints, often employed as one of the indications for a diagnosis of degenerative disc disease, which also has, that's the same name for stenosis or arthritis of the discs as well. Those are all the same names. Were found in more than half of normal subjects over 40, meaning they didn't have any pain, they were fine, and in nearly 90% of those over 60. So the more and more evidence is pointing towards imaging. Is if you get an image of your spine, regardless of what age, there's going to be something found. Here's another one. Bone spurs on a scan are common in pain-free subjects as well. Mayo Clinic scientists concluded that such changes were not part of a pathological process requiring intervention. So why would you want to get an image on your spine when you know you're going to find something in there? And then you're going to be more likely to be convinced that surgery is the answer. The bottom line is MRIs and x-rays increase the likelihood you will have a back surgery, and in many cases it's unnecessary. Here's another study. Here's a study that frames all of these conditions that you would find in an MRI and x-ray. And you can see here the ages: 20, 30, 40, 50, 60, 70, 80. Disc degeneration, 37. By the way, these are pain-free, asymptomatic patients. Hundreds of thousands of pain-free people. 37% of 20-year-olds had disc degeneration in this study, 96% of 80-year-olds. If you go down to disc bulges, 30% of people at the age of 20 who had no pain had a disc bulge. 69% of people that are 60 years old have a disc bulge with no pain in the study. A disc protrusion is a little bit more advanced disc bulge where the disc herniates out. You can see 29% of people in their 20s have that with no pain. And again, 38% of people at the age of 60 have it with no pain. So again, the evidence points towards you should not want to get an MRI or an x-ray when you have back pain. Unless you have those 4 red flags, you should not demand one from your doctor or your physical therapist. You should allow the physical therapist, the musculoskeletal back pain expert, to help you, and you should resist the urge to want to get an x-ray or an MRI unless you have those 4 red flags that we presented in the beginning, because it's going to find something on there. You're going to find something on that image. And I know you want to, I remember this. I know I wanted to have a name for it. I wanted to have evidence for why I was in so much pain, because pain is hidden. Nobody can see pain. I wanted my wife to be able to see that I was in pain. I wanted a reason to point to. And the problem is that image led me down a path to get surgery, which didn't help. I'm lucky to walk away from that surgery. I'm okay, but some people don't. Surgery has risk. And so you want to try to avoid the high-risk procedures, and you want to do the things that are going to be the most likely to help you, and that's not surgery. Therefore, imaging does not help anybody. It doesn't help me find out what's wrong with you. It doesn't help you. So again, try to resist the urge to get an image, and we'll talk more about that as we move forward.